Everyone, I made a video a few days ago celebrating my 1 year anniversary for total knee replacement, and on that particular day I mainly talked about how great it was to be at a point where I was fully recovered and just celebrating life. Well, today I want to talk to you a little bit more about what that looks like medically. At the 1 year mark, I have a significantly less pain and quite a bit more mobility than I've experienced in quite a few years. When I finished with my 2 surgeries in March of 2015, my surgeon expected that I would be able to bend my knee to 95 degrees, which 90 degrees is considered to be a functional knee. I was only expected to reach 95 degrees because my leg was so badly damaged prior to the surgery, and that has an effect on the outcome or the degrees at which you are able to regain. So my surgeon wanted me to regain 95 degrees. I went to physical therapy, had 30 visits with my physical therapist. My insurance would cover that many, so that's how many I had. At that point, I had reached 102 degrees, and we celebrated wildly because that was more than what was ever expected of me. But I told my physical therapist I would continue to work on my own, and I did. Not as hard as I could have, but I did continue to work. So when I went back to physical therapy after having my left knee replaced in December, he did a measurement, and my right knee was at 106 degrees, which was 4 more degrees than which I'd had in the summer when I left him. And I guess it had been probably about 3 months in that time period. Well, when I started physical therapy for my left leg, though, I decided that everything I did for my left leg, I would continue to do for my right leg. And I am astonished at the results that has brought about. At last check, my physical therapist measured 114 degrees, which is just out of this world. And that has just given me so much more mobility than I ever anticipated getting back. So 90 days for my left knee, what does that look like? My left knee was not as badly damaged as my right one, so when I left the hospital, it was already at 89 degrees. First physical therapy session, outpatient, I got to, I think it was 106 degrees. So at this point, at last measurement, my left knee would be into 121 degrees. And that is me doing it on my own without the physical therapist pushing on it any. So mainly what we've been working on now is functional strength and mobility. As I've stated before, I had some muscle atrophy after years of really not being able to do much exercise. So my thighs were weak. They were really, really weak. So, and my hips, it's amazing. I always talk about how everything is connected and how everything works together. And I'm really seeing that more and more firsthand with the hips and the glutes and the thigh muscles and the ligaments and tendons around your knee. They all work together to stabilize you. And so now we've really been working on just my core strength. I told my surgeon that my goal was to be able to climb a flight of stairs in a reciprocal fashion, the way you would ordinarily climb, because I've been doing it with one leg, going up with my left leg and just stepping up with the right, and in that kind of fashion for years. And he said that I can anticipate probably being able to climb a flight of stairs probably by the summer. Well, I'm happy to announce that I can climb a flight of stairs in a reciprocal sense now, and I'm at 90 days today, so that is phenomenal. The things that have transpired in the last few months, well, just in the last year really, it's been unbelievable. But knee replacement surgery is not a minor surgery, it's a major surgery, and the recovery from it has its ups and downs, but I don't regret it one bit. The life that I now have doesn't hold. It's just unbelievable. I can't really verbalize what it means to be able to go out and enjoy a beautiful day. Like today is in the upper 70s, I think, and it's very nice and sunny. But there was a time when I would have to stay in the house just because I couldn't bear to walk on my leg. It was just that painful. But now I've got 2 fully functioning knees. I went camping this past weekend for the first time in my life, and I'm looking forward to everything that life has to offer me. Now, even though I wasn't able to do much physically before, I didn't stay home and sit on the couch. Then I just wasn't able to exercise. So now I'm just looking forward to a life where I can be more active and more mobile and get out and enjoy nature and spend time playing with my nieces and nephews. It's funny because my nieces and nephews that I started out playing with, they're grown now, but now I have little ones. So it'll be nice to be able to do some of the things with them that I did with some of the older kids, like playing basketball and even just chasing them around the yard. That wouldn't have been possible a few years ago, but it is now. So I just wanted to take a few minutes and let you know what it looks like from a medical point of view as far as degrees, what 1 year looks like and what 90 days looks like. And if you keep working it, no matter what stage you're at, you can continue to improve. But what happens is most patients finish physical therapy and they go home and they either settle back into the life that they've been leading, or they don't continue to work and push their knee. So it stays at the degrees that they were at when they left physical therapy. Or they continue to have pain. Well, muscle supports that joint, and you need to build a muscle in the thighs. And the more muscles that you have, the less pain you're going to experience. The amount of pain afterwards also depends on the damage you had before your surgery. My older brother, he had knee replacement a couple of years before I did, and we were talking this past weekend. He didn't have any pain. And at the 1 year mark, he was completely pain free. But my knee was much more damaged than his, so I'm still having some residual pain when it's really cloudy, or if I have a lot of activity, I'll have some pain. Now the pain that I'm experiencing now doesn't hold a candle to the pain that I used to experience on a day-to-day basis before. So it was truly worth it. Now, am I saying everybody run out and get a knee replacement because your doctor said you have arthritis? No, that's not what I'm saying at all. But what I am saying, that if you know that you need a knee replacement,